Okay, we have to talk about a lot of things. Now, we have to talk about severe malaria. We have to talk about acute renal failure. We have to talk about diabetic keto acidosis. But it's not to describe all of them. Okay, the question here is this: list 5 clinical features and 5 laboratory features or imaging features of severe malaria, acute renal failure, and diabetic keto acidosis. So 3 disease conditions, but you have to just talk about some few things about them. So clinical features. Now, for severe malaria, you have fever with chills and rigors, altered consciousness. That's when the malaria actually got to the cerebral level, causing seizures and also coma. You can have pallor, you can have jaundice, you can have respiratory distress. Okay. Then for the lab or imaging features, if you do a blood smear, you see positive malaria parasite test. Okay. Then severe anemia, hypoglycemia, metabolic acidosis. So bicarbonate levels are usually low, and you get to see that liver enzymes are elevated, and also bilirubin is elevated. Why? Because there's active destruction of red blood cells. Now, moving to the next disease conditions. For next disease conditions, acute renal failure. Okay, it's acute renal failure. So for the acute renal failure, let's talk about the clinical features, 5 of them. If you have acute renal failure, of course, you are producing low urine, or you are not producing urine at all. So there's oliguria or there's anuria. Okay, peripheral edema, hypertension, urgency symptoms like nausea, vomiting, confusion, seizures. Then most of the times, something is causing the acute renal failure, right? So you can also have the signs of that thing causing the acute renal failure showing off. Then for the lab results and imaging features, you see that the serum creatinine and urea is high. Why? Because the kidneys is no longer clearing out the creatinine and urine and urea like it's used to. So elevated electrolyte disturbances, hyperkalemia, metabolic acidosis. Then urinalysis is abnormal, so you see hematuria, that's blood in urine. You can see proteinuria, that's proteins in urine. Then if you do renal ultrasound, you can see that kidneys could be normal. Okay. Then chest x-rays, you see pulmonary edema because of fluid overload. The kidneys is no longer clearing out fluid like it used to. So moving to the next disease condition, which is diabetic keto acidosis. Clinical features is polyuria. So you are passing out so much urine. Now, because you are passing out so much urine, you are getting dehydrated. So you want to now be taking so much water. So polyuria and polydipsia and dehydration are the features. The first features of diabetic keto acidosis, if you are ever asked. Then there's Kussmaul breathing, deep rapid respiration, abdominal pain and vomiting, altered sensorineuron, so you are confused, you are drowsy, coma, okay, fruity odor of breath. So for the lab or imaging features, you see that there's hyperglycemia, so glucose levels are actually shooting up so high, more than 250 milligrams per dl. Metabolic acidosis, so the pH of the body is actually going below 7.3. So positive urine ketones, you see ketones in urine, that's ketonuria. They also see ketones in the serum, that's or ketones in blood, that's ketonemia. Okay, so electrolyte abnormalities, okay, and all of that. So that's what we got for talking about the signs and symptoms of severe malaria, acute renal failure, and diabetic ketoacidosis. Then also the lab features and the imaging features if applied.